Welcome to today's episode of Aesthetics and Wellness by Dr. Yusra. On this episode, I have spoken to Jennifer Boggiano, dental hygiene therapist, present here at the Dr. Yusra clinic. We have spoken today about the link between oral health, oral disease, and a range of different systemic diseases, including Alzheimer's disease, dementia, cardiovascular disease, and even cancer. Tune in to learn more about how to spot the signs of gum disease, how to prevent rapid decline of cognitive function, and learn all the tips on how to look after your teeth best at home. Okay, so today on the Aesthetics and Wellness podcast by Dr. Yusra, we have got Jennifer Boggiano, who is a dental hygiene therapist qualified from the United Kingdom in Birmingham, worked in Ireland, and works at the Dr. Yusra dental clinic in Liverpool. You're okay with me calling you Jen?
Yes, please.
Jen, tell us a little bit about you, because today we're going to be talking about systemic disease, about the link between oral hygiene, oral health, and systemic disease. And I know you're amazing at this stuff, and our patients are super interested about why oral health is even important. So tell me a little bit about you, your training, your background.
So I trained at the University of Birmingham. I studied dental hygiene and dental therapy. I qualified 3.5 years ago now. Since then, was working in Belfast, Northern Ireland, and then now over here in Liverpool, which is where I'm from.
Yeah.
I work in general practice, so both NHS and private, treating dental diseases. Yeah. Gum disease, decay, things like that.
But you have a specific interest in aesthetic dentistry as well. You're doing a diploma, an advanced course.
I'm currently studying for my postgraduate diploma for aesthetic and restorative dental therapy with Monic Vassant down in London.
And he's amazing. If anyone knows him, he's kind of like the OG of composite dentistry. And I think this is really interesting because a lot of people don't know the difference between a hygienist, a traditional hygienist, and a hygiene therapist or a dental therapist whose scope of practice is a lot more. Tell us a bit about that distinction.
Different qualifications, and I'm dual qualified. A lot of the courses nowadays will offer it as a dual qualification. However, there are dental hygienists who aren't dental therapists and vice versa. Yeah. Dental hygienists primarily treat gum disease and clean your teeth, treat your gums. And dental therapists, they tend to treat the dental disease in the tooth. So they provide restorations, fillings. They use composite to make your teeth look prettier and teeth whitening, things like that. So that's the differences between the two.
Yes. So essentially, a dental therapist can do a heck of a lot more than a traditional hygienist alone. And there's scope of performing dental checkups, assessments, like you said, teeth whitening, restorations, composite bonding. And I think the scope of practice means that there's a lot more offering and a lot more understanding. And I know, because I've had treatment with you as well, that you are super gentle but super knowledgeable, and that you love to educate your patients.
Thank you.
So that I think is very important. I'm very selective about who I bring on to the Dr. Yusra clinic. And I know that you are very much of the same ethos of providing ethical care, but also educating your patients so that they understand what to do at home, how to look after their teeth, and even why it's so important. And now more than ever, we are aware that the oral cavity isn't kind of this isolated area away from the body that is just there for a good breath and maybe to look nice when you smile, but actually
affects everything.
Affects absolutely everything. And when I say everything, I mean from oral health to cancer, to cognitive function, to the development of cardiovascular disease, Alzheimer's disease, rheumatoid arthritis, diabetes. So there's a huge amount of systemic illnesses that are linked to oral health.
So the chronic inflammation that people get in their mouth and their gums is linked to chronic inflammation in the rest of the mouth and everything that inflammation affects. Inflammation of your gums, the things that are linked with that inflammatory process travels everywhere throughout the body. So it's really important to remember when I'm just in my little surgery telling you to use your TP brushes once a day. It's not just to keep your gums healthy and your mouth healthy, it's to keep the rest of you healthy.
So the whole body, right?
Yeah.
So this is where it comes down to holistic health.
Yeah.
So when we talk about holistic health, this is something that is one of my ethos and something I'm very passionate about and have been from day dot, which is why we created this 360 clinic. So we're not just looking after patients' skin health or aesthetic health or physical health or mind health or indeed dental health in isolation, but we understand that everything impacts everything else.
Yeah.
When it comes to the oral cavity, what we know is that what we see as dental professionals, what we see in the mouth, we can actually diagnose and be the first to diagnose systemic disease. And I'm talking anemia, I'm talking about leukemia, so blood-related.
Spontaneous bleeding from your gums can often be the first sign of leukemia, cancer. And the patient might not realise that it's even happening. But if a patient presents and, they've got really good oral hygiene, they haven't got any plaque evidence there, and their gums are bleeding a lot.
All of a sudden.
Everywhere, spontaneously, so without touching them, then it can be a really big significant factor.
So I've seen patients with that, and I feel like I'm honoured and privileged to be in a position where I have been able to, I feel, safeguard my patients from decline in their general health because of picking up signs and symptoms of things going on systemically that they would have otherwise ignored. I have patients who have had spontaneous bleeding in the gums, and we found out that they have aplastic anemia. I've seen head and neck cancers, and sometimes things that patients don't even think is a big deal is actually a sign of something really serious going on. And that is why it's so important to see a dentist. Because actually, when we say, do you need to see a dentist regularly? Is there even a need to see a dentist or a dental therapist? Is it important? I'll just brush my teeth, floss at home. Yeah, right.
Yeah.
But I'll brush my teeth at home. And do people need to see their dentists?
Yeah, and that's why it's important to come see us regularly. It's not just, come see us once every few years. We want to see you. For majority of people, it's every 6 months. Sometimes it's shorter than that, sometimes it's longer. But majority, every 6 months for a checkup and or dental hygiene appointment. And it's because changes. So it's important to monitor what's normal for you and what can change, because things can happen really quickly. And actually, if you miss your dental checkup and you don't go for a year or two, then actually that change, it's been missed and we haven't been able to catch something early when it might have been easily rectified or sorted or treated, and it's been able to develop.
So let's talk about what kind of changes, because I think a lot of people go, still not convinced. Okay, so they think I don't buy it. I've been fine. One of those people is my husband. Trying to get him into a dental clinic, it's literally by force. I drag him in and I get his teeth cleaned, and it's like kicking, screaming almost, and it's not pleasant for him. It's not pleasant for me because he's unconvinced. Now, he is a psychiatrist, and I have put in front of him clinical research and data that has shown that there is a link between cognitive health, psychological health, and oral health. And now, finally, the man's listening. So I want to talk about the kind of things that people don't realize can happen when it comes to oral health and why it's so relevant. And I think we need to go right down to basics. So how does disease occur in the mouth? Tell me how that happens.
So starting from the beginning, kind of the basics of oral health is your oral hygiene. So toothbrushing. You want to make sure that you're brushing your teeth 2 times a day, 2 minutes, preferably with an electric toothbrush if you can cope with it. And hopefully also some incidental cleaning as well once a day.
What do you mean if you can cope with it? Because I actually think that once you've gone to an electric toothbrush, it's so hard to go back.
It's more for the patients with maybe like arthritis or things that struggle with the vibrations. Some people like maybe severe gag reflex. They don't like the electric toothbrush. Everybody else, they should get used to it. It just takes a couple of weeks. But definitely electric toothbrush. And it's the plaque. So as soon as you've brushed your teeth, it starts to grow back. And that's why you need to do it twice a day.
So plaque is that layer of gunk on your teeth.
Yeah. So if you've ever noticed, it's removable, it's soft, it grows throughout the day. If it's not brushed away, then you can start to see it and it becomes kind of white and fluffy.
Yeah.
And it kind of lives over the surface of the tooth, any hard surfaces in the mouth.
So it's that creamy, yellowish layer that builds up on your teeth and on the edges of your gums.
Yeah.
and is constant. As soon as you stop brushing your teeth, it starts to form. And what's in plaque?
So it's all about the biofilm, so the bacterial biofilm. And what it does, it builds up a wall on the surface of the tooth. So you get biofilm in any moist environment on the hard surfaces. In that biofilm, bacteria thrive. They love to grow. However, if you brush it away, it doesn't get a chance to cause any damage. If it's left and not brushed away, then it starts to thrive.
Yeah.
It can grow and then it can start causing problems. Your body will kind of go, oh, let's fight this away.
Yeah.
So your body will kind of send all of its defenses to that part of your body. So your gums will then start to be a little bit inflamed. They might feel a little bit puffy. You might get a little bit of bleeding. And that inflammation has then started. So if you ever get any bleeding from your gums, that's not normal. That's not healthy.
I'm so glad you said that, because 99% of the patients that I see, and I'm sure you're the same, say to me, yeah, my gum, I don't floss because my gums bleed.
Yeah, they get scared.
Yeah.
Because if you don't know and you brush your teeth and you floss your teeth, you spit out and you see blood, you think, oh no, like I don't want to cause trauma. Yeah. That hurts. Yeah. Like I shouldn't do that. Their mind tells you, let's not do that. Yeah, actually it's the complete opposite.
Yeah.
If you get bleeding from your gums, it's not trauma, it's inflammation, and it's a symptom of that biofilm is there, it's maturing and it's thriving. And if it's not already, it's about to start causing some problems.
Yeah. So we're going to break this down. So the bacteria that lives in this creamy white plaque that builds up all the time causes inflammation in the surrounding areas.
Yeah.
And it causes inflammation in the gums. And when that happens, you get swollen gums and bleeding gums. And we know that can happen quite quickly, can't it, if you don't brush your teeth?
Yeah, so that's what we call gingivitis.
Yeah.
So that's where kind of the beginning of gum disease starts. When it's in this kind of stage, it's reversible.
Yeah.
So by simply changing your oral hygiene routine, introducing a couple of different techniques, knowing where actually you are missing, so that you're able to then reach those places, brush those every day, you can solve the problem. Quite quickly.
Yeah. How quickly?
From anywhere between kind of 4 days to I say kind of 3 weeks.
Yeah.
But you can really reduce that bleeding quite quickly.
Yeah.
And you just need a little help.
So point number one people need to understand is bleeding gums isn't normal.
It's not normal.
And if you see bleeding gums, if you're not flossing because floss is that little piece of string that you put between your teeth to get the gunk out between teeth. Because what a lot of people don't realize, they think, oh, if I brush my teeth, it's enough.
Yeah.
But actually, if you're not getting the gunk out in between your teeth, and toothbrushes, the bristles can't get in between the surfaces of the teeth, they're stuck together. Bacteria builds up in between the teeth, and that causes inflammation in between the teeth. And that means you get swollen gums, bleeding gums, which is painless. This is another thing.
It's often painless. In majority of patients, it is painless. So when they say, is it going to hurt? Actually, the majority of patients, they don't feel it at all.
Yeah.
And if you come to me and actually it is really uncomfortable, then you just need to tell me, because I'll always be led by the patient. So if the patient needs to, if it is uncomfortable, then we'll numb them up.
Yeah.
So then it is completely pain-free. I think that's the main thing to know, is never worry about coming because it's going to be painful.
Yeah,
because actually we'll always manage that. And actually for majority of people, it's not.
Yeah.
We only have to numb up a small percentage of patients for the cleaning. But actually for those ones, they just need to know that it's there.
So then that's two takeaways. Number one, bleeding gums isn't normal. Come in and get it checked. And number two, don't be afraid.
Don't be afraid.
It's not painful.
Yeah.
And I guess number three also is, because it's reversible, that's amazing news.
Yeah.
And you can reverse it quite quickly within 4 days to 2 weeks usually. You can, if you're doing the right things at home, which is mechanical debridement, removal of that plaque biofilm, then your gums will go back to full health.
If they remove that bacteria every day, if they can get into those crevices, into those areas, your body no longer has to fight off the bacteria. Yeah. So that inflammation cycle stops.
Yeah.
So your gums shrink back down, there's all that swelling goes, they get tight around the teeth again, and the bleeding goes.
Okay, so what else are the signs and symptoms of gingivitis? How would you know? Do they get bad breath?
Bad breath. The bacteria that's there and thriving in the mouth produces a bad smell. So you do get bad breath. Main thing is the first signs would be the bleeding from the gums. When that's left, and over many years, when it's left to progress and it's not treated, then you start to get bone loss. So while your body's fighting off those bacteria, it's actually destroying the bone.
Yeah.
So you start to lose bone around the teeth. That's when you start to get wobbly teeth.
So now what's that called? Because that's not gingivitis. Now we're moving into periodontitis. Right.
So when you ever hear anyone say periodontitis, that is the name of gum disease.
Yeah.
And that is affecting, it's a disease of the fibers of the gums surrounding the teeth. So it's the periodontal ligament that holds your teeth in place. It's those structures. Yeah. When they break down, there's then nothing to hold your teeth in place. So you start to get tooth mobility and eventually tooth loss, which obviously is a huge thing. It affects speech, being able to eat, mental health. And then obviously we now know the bacteria that's causing all of that can spread to the rest of the body and can then cause other systemic health conditions as well.
So before we get into that, let's talk about. So we've got gingivitis. That's a reversible condition.
Yeah.
And then we've got periodontitis, which is not just inflammation of the gums, but inflammation of all of the structure around the tooth, which includes ligaments and bone. And so your tooth is embedded in the bone. The reason why it's staying where it is when you eat is because it's embedded in the bone. But if your gums are swollen for a really long period of time, bacteria are super happy because they thrive. They get underneath that swollen gum.
They get deeper and deeper.
And they eat away the bone, literally. You get osteoclastic activity, which means that the bone starts to resorb. The problem there is we can't make that bone grow back. So it's irreversible.
So we can't gain back the bone that we've lost, but we can prevent it from getting any worse.
So that's a big thing.
When the treatment that I'm doing with my patients is we're trying to just stabilize the disease. We can't reverse time once you started to lose the bone, but we can try and stop you losing any more.
And I think it's really important to understand that because actually, even with wobbly teeth, patients, I find a lot of people are afraid of their dentist because traditionally the dentists were not as nice as you and they were held down, or were not as kind, didn't give them local anesthetic. There's a lot of fear around going into a dental practice. It's not unusual for patients to walk in and say to the dentist, no offense, but I hate coming here. Okay. It's not because of you, it's not personal.
Like, let's get this over with. I don't want.
And actually, what I find with seeing you, Jen, is that they come out and they have an amazing experience, and that fear factor is gone because they realize it's not scary, it's not painful, and actually it's quite liberating, empowering, informative, and they realize how much they can do. But the thing that brings them into the clinic, apart from aesthetics, because everyone wants a nice smile, particularly in Liverpool. Everyone wants their, I don't want to say chiclet teeth, but you know where I'm going with this. And what I find is that people are coming in saying, my teeth are wobbly or my teeth have started to move. Bleeding gums they tend to ignore as much as they possibly can, unless they've been forced in by their husbands or wives. Their partners to say, listen, your breast stinks, no kisses tonight, go and get this sorted. So at that point, they are coming in. And when they realize gum disease is really serious and gum disease can affect your whole health, and also you only have one set of teeth. Once you start losing the bone around your teeth and that tooth has essentially fallen out, number one, you can't make that tooth come back. So you can't grow it back. You only got that one tooth. And that's why I always say floss the teeth you want to keep.
I had a tutor say that to me when I was a student.
It sticks, doesn't it?
And I've always said
it since then.
And sometimes I'll say, I don't say it very often to patients, but sometimes I feel like it'll get to the stage where we do, and I'll say, a tutor once told me when I was studying, floss the ones you want to keep. And sometimes all it takes is just one phrase to go, oh God, maybe I should.
Point. Yeah, good point.
Let's get motivated this time. Because the hardest part is just motivation. It's really easy for us to say in clinic, do this, do that, but actually following it through at home and being able to do it every day is actually, it's not easy to make a habit. You know what
I think? I think that you're amazing, but generally speaking, people don't do a good enough job at educating their patients. And if patients don't understand, if we just say to them, do this, but they don't understand why they need to do it, why would they do it? I wouldn't do it. If I didn't think it was important, I wouldn't do it.
I like to always make my points quite positive. Think about positive behaviour change to make them feel better. Because really, dental disease is affecting everything, isn't it? It's affecting their mental health, affecting their systemic health. And so giving them positive changes and feeling good about that and feeling that they're capable of making those changes. Actually, that's why they're walking out of my room kind of thing, let's go, let's do this. I'm going to be motivated again. Rather than actually...
If you don't floss, you're going to lose all your teeth.
Exactly.
Okay, great. So now let's talk about the link between dental health, oral health, and cognitive health.
Yeah.
Talk to me about that, because that is some amazing emerging evidence about the causative link of cognitive decline.
Yeah. So, there's been lots of studies now, but one in particular is for over 50s. If you have had periodontal disease, so gum disease, where you're losing bone for over 10 years, you are 70% more likely to develop cognitive decline. So things like dementia. Yeah. And that's a really high number.
That's
and to think
scary.
that, so periodontal disease is the 6th most common disease worldwide.
Yeah.
So it's really, really common. There's a lot of adults walking around with
they say
disease.
that somewhere between 70 to 80% of the British public have got gum disease. Undiagnosed gum disease. So that is huge. And gum disease left untreated, and we know that if gum disease has been left untreated for 10 years, then you're 70% more likely to get cognitive decline. And we know that if you do have Alzheimer's disease and you have gum disease, the progress of that Alzheimer's disease, the decline in cognitive function happens 6-fold faster.
Yeah. So the basically all of that inflammatory response that we're talking about that's happening in your gums, all of those things that are contributing to that inflammatory process, they move around the body. They not only move around the body to your heart, to the digestive system, they also cross the blood-brain barrier.
Yeah.
So that bacteria and those inflammatory response mediators, they go into your brain.
Yeah.
And they have found that those things, there's a couple of things in particular, like the interleukin-1, interleukin-6, TNF-alpha, C-reactive protein. They found those then causing the inflammation in the brain. And that is how that link happens.
It's fascinating. So again, what people don't realize is that the oral mucosa, so that the skin inside the mouth, the lining of the mouth is called the oral mucosa.
Yeah.
And the oral mucosa is one of the easiest ways to absorb things.
Yeah.
So the barrier is, there's a lot of permeability.
Yep.
So actually, if you want to put, aspirin, for example, is absorbed so quickly through the oral mucosa, GTN, etc. Bacteria in the mouth, and there's millions of bacteria in the mouth, but the Porphyromonas gingivitis, also known as P. gingivitis, which is an anaerobic bacteria that thrives without oxygen. So when you have swelling in the gums, this P. gingivitis, this little devilish bacteria, sits underneath the gums and causes all kinds of disease and inflammation. But also, it doesn't just stay there. It actually gets absorbed through that oral mucosa, through the skin of your mouth, and into your bloodstream, travels up to your brain and causes inflammation in the brain. Yeah. And then there's the inflammatory markers and mediators, like you talked about, the cytokines, the interleukin-6, that pass through that barrier again, up into the brain and cause inflammation in the brain. And if you've got inflammation in the brain, you get cognitive decline. Yeah. And that will be things like memory loss, brain fog, inability to function, can't think as quickly, and can lead to permanent and irreversible degeneration in the brain. So, with Alzheimer's, there's a lot of discussion about, well, if we treated gum disease and we stopped gum disease, yes, we can reduce the rate of decline of cognitive decline or cognitive function. But what we can't do is we can't reverse Alzheimer's. So what we want to do is we want to stabilize that gum disease and treat it ASAP to stop that inflammation and stop the bacteria traveling there. But there's also things about plaques. So tell me about that.
So there's a couple of the reasons of why dementia occurs. One of them, one is with that inflammation, and another is something called amyloid plaques. Yeah. And they've found that patients with Alzheimer's and periodontal disease have more of these plaques in their brain, which is then stopping these signals. So
the signals in the brain.
Yeah, so in the brain, which is then obviously then slowing things down with cognitive thoughts. But they found that they have more of these plaques. Yeah. And there's a link between the inflammatory mediators and how these plaques are formed. Yeah. And so because if you've got periodontal disease, the rate at which you're building these plaques is just quicker, and you end up having more of them. It's not to say that if you don't have periodontal disease, you won't get Alzheimer's disease.
But
it's
if
not
you do
as clear
have
cut
it,
as that.
you have a 70% higher risk of developing it. Yeah. And if you do have it, you have a 6 times fold increase in the the acceleration and the rate of cognitive decline. So I think that's the thing, is that we can't say if you don't have gum disease, you're not going to get Alzheimer's. But if you do have gum disease, you are much more likely to get Alzheimer's. And if you don't treat the gum disease, you're much more likely to have Alzheimer's get worse over time quickly. So one of it is the inflammation. The other one is that monstrous little P. gingivalis bacteria. And the other thing is that bacteria releases an enzyme that breaks down the proteins in the brain called the tau proteins. So all of these things are going on. And I think it's so fascinating and so important that people know, because Alzheimer's is such a common condition now in the elderly. And what we have done very well in medicine is we've been able to increase lifespan, i.e. we're living a lot longer, but we haven't done a good job at empowering patients to understand how they can impact their health span. So they're living longer, but it doesn't mean they're living healthier. And the quality of their life is amazing. So they might live to 100, but if they're developing Alzheimer's at 70, then the quality of their life declines so rapidly, and it impacts not just them, but everyone around them. So what we want is our patients to live longer, healthier, happier, and really have an amazing quality of life for as long as they possibly can. And then
it's not just dementia. So we're talking about that link of gum disease and dementia, but it's, we did say all sorts of systemic diseases. That bacteria gets into your bloodstream. So it goes to your heart. So it increases your risk of cardiovascular disease. So disease of your heart. It can go respiratory diseases, cancers, things like pancreatic cancer. So they find that that P. gingivalis, that bacteria that we were talking about that's found in gum disease, also travels. And they find that when patients have had pancreatic cancer, they're finding this gum bacteria in their pancreas. So a huge array of things that it actually affects. And when you start reading into this, you're realizing that actually inflammation anywhere in the body affects inflammation everywhere else in the body.
Absolutely.
And so helping treat one thing will help the other things in your body also.
Absolutely. Inflammation is the precursor for all disease. And inflammation is one of the worst things for aging. In fact, there are 12 hallmarks of aging. And obviously I'm into anti-aging medicine, longevity medicine. And what I try to do for my patients is empower them to reduce inflammation all over their body, from their oral cavity to their skin to everywhere, because it's all related. So you're quite right. P. gingivitis is that nasty little bug that causes that can increase the development and decline of cognitive function, but also cardiovascular disease, also cancer, and also is found in bacterial vaginosis. So in vagina, it travels, and it travels everywhere. So when we are talking about oral health being so important for systemic disease, we say that it's a mirror, don't we? We say the oral cavity is a mirror for systemic disease, and often dental professionals will be the first people that pick up signs of systemic disease. And we talked about aplastic anemia. We talked about leukemia. I often see patients with a cracked area in the corner of their lip, and they go, oh, it's just a bit dry, which happens more in the winter. And actually, it's not. It's angular colitis. They've got a fungal infection, which is much more likely to develop if they have anemia. So I'm looking, and they go, I've been back to my GP 100 times. And I'm like, you've got anemia. And they didn't think about it. They go and they get a blood test. Lo and behold, they've got anemia. They treat the anemia. Away goes the angular colitis. Their lips are no longer cracking. The corner of the lips are no longer cracking. So there's all of this. Ulcers in the mouth, all kinds of things that we see, lichen planus, etc. So yes, inflammation. And then also it's important to understand that the oral cavity is connected to everything. You know how like when we are children, we're told that your neck bone's connected to your shoulder bones, and your shoulder bone's connected to your whatever other bones. Everything's connected on a bony level, but everything's connected from a superficial level as well. And the oral cavity is the first part of your digestive tract, and is full of bacteria. I'm talking millions of bacteria. And it's connected to your esophagus, which is connected to your stomach, which is connected to your small, your duodenum, your small intestine, and your large intestine, your colon, and ultimately the exit pathway. Okay, so you're the anus. So it's very important to understand that the digestive tract is one continuous tract.
A big example of that link is things like Crohn's disease. A lot of people have heard of Crohn's disease now, and they know, it's a digestive issue, it's a disease. That is often picked up on first with oral manifestations.
Yes, absolutely.
they don't really, and actually those symptoms, if we can spot them and go, actually, that's not right, I'd like to refer you to somebody else.
Yeah.
And actually that can be picked up on before it's able to get much worse, much more uncomfortable for them.
Yeah.
And they can start to get treatment quicker before they get more ill.
Well, before they get destruction of their guts, because when you do have things like Crohn's disease or ulcerative colitis, many patients do end up with a colostomy bag.
Yep.
Because they've got such bad inflammation now that hasn't been controlled for such a long period of time. And another thing that people don't realize is tooth loss, the risk of tooth loss. Once you lose teeth, you are much more likely to have depression. Your lifespan reduces significantly. So the more teeth you lose, the faster you are to develop cognitive decline, and also it impacts your actual lifespan.
Yeah.
So these things I think are very important for people to understand.
It's a huge thing mentally as well. Like feeling confident about your oral health and your smile makes a huge impact on your day-to-day confidence life. Being confident to able to just do normal things like having a normal conversation, sat at someone, smile to someone. And I think it's easy
the
to forget
self-esteem and the confidence.
Makes a huge impact.
Yeah. I think it's also the confidence to express yourself. I see a lot of patients that go, or if they laugh, they cover their mouth because they feel embarrassed about how they look when they smile, or they're embarrassed about their teeth, or indeed their gums, or their gums are spontaneously bleeding. And again, people don't really understand that is a reversible condition. So this is not all doom and gloom. That the real take-home message here is this is a modifiable disease.
Yeah.
This is a disease that you can control. You might not be able to control Alzheimer's. You might not be able to control all of cardiovascular health. But you know what you don't do? You don't wait until you have a heart attack to start looking after your general health, going to the gym, walking, eating healthy. You have this preventative care. Prevention in all forms of medicine is better than cure. And with gum disease, you can prevent it, and you can treat it, and you can stabilize it, and you can get rid of that nasty bacteria. And it's not just P. gingivalis, it's also treponema, it's also streptococcus.
AA.
Yeah, that ends up going into the heart. It can cause cardiovascular disease, like you said, cancer, bacterial vaginosis. So when we're talking about the link, I'm going to even go further, because one of the things that we talk a lot about now in aesthetic medicine is gut health. And we talk about how if you've got, in our guts, we've got a lot of bacteria. And you've got good bacteria and bad bacteria. And there's always a play of good versus bad bacteria. Yeah. And if you have a pro-inflammatory lifestyle, you're smoking, you're not eating healthy, you're on loads of sugary foods, high glycemic index, then your bad bacteria are going to be thriving. They're going to be loving this environment. And you might get away with it in your 20s, even your 30s, 40s, it hits you. You're not going to get away with this forever. And the bad bacteria actually eats away at your hormones. And for women, it eats away at estrogen. Yeah. And so gut health is linked to general health, and good bacteria is very important to balance. Now, that starts from what you eat, because every single time you put anything in your mouth, sugar, a cup of tea with milk in it, which has lactose in it, the bacteria in your mouth start to break down that sugar, and it creates an acidic environment. And then you're swallowing that acidic environment, which remains for 45 minutes to 60 minutes. And that's impacting your gut health. And that's also impacting your hormonal health. So this link is you cannot look at the body and treat the body in isolation. This is why holistic health is so important.
Yeah, for sure. And they do now say that actually treating for women of childbearing age, if they have gum disease, they have found that actually it could be affecting their ability to conceive.
That's right, their fertility. I've read about this,
so it doesn't just affect you. So we were talking about over 50s and dementia, but actually affecting young people.
Yes.
Wanting to start a family. And if you're able to, it's a modifiable risk factor. So obviously there's several factors that will affect fertility, things like that. But actually that's something that's in control that you can do by yourself in your bathroom. Yeah. It's dental disease where it's really fortunate that actually you can reach there. Yeah. So, and you can change that. Whereas other inflammatory diseases, you can't get there. There's nothing you can do, but actually you can make that change at home. Yeah. Simple by toothbrushing techniques, brushes that will be suited for your mouth, things like that, toothpaste. Actually, it makes such a difference, and you can do it at home.
I just got an idea. There's a book called, so that when we talk about aesthetic medicine and anti-aging medicine, when I talk about the face, I always educate my patients that, look, what you're seeing on the outside is skin, but underneath your skin, there's multiple layers of the face. But your skin is a canvas, and your skin has to be in optimal condition. So when I'm doing an aesthetic treatment plan, I always say start with skincare. And I think what everyone needs to be telling their patients when it comes to general health is start with dental care.
Yeah.
Because you're right, it affects, so we know that it affects your brain, it affects your heart, it affects your joints. Rheumatoid arthritis is, you get a lot more inflammation, rheumatoid arthritis, and progressive disease if you have gum disease. So your joints, it affects your ability to conceive. So every single thing. And what I think traditional medicine, where I think traditional medicine has gone wrong, and you know, this might be controversial, but I feel that medical practitioners who are incredible, but and we, you know, so many of us are specialized in certain areas of health. We become hyper specialized in that one area and not really understand or link the dots of the different areas of the body. But actually, you're not just treating a mouth or teeth or gums. I'm not just treating a nose or skin. I'm treating a person, and it's all about holistic care. And that means that we have a duty of care to understand how everything is linked and to join and connect the dots. And so instead of just going to the patient, oh yeah, you know what, you've got a rash on here, here's some pills. Why don't we actually start to go back to the basics and look at the entire person, look at their entire holistic health. What are they eating? What are they drinking? When are they sleeping? Are they brushing their teeth? What's their gums like? Do they have inflammation in their gums? And get to the basics. And also, as you know, in all of healthcare, we always say simple things first. Start with the simple things. Treating gum disease is probably the most simple thing to do. Yeah. And it's something that people are fully, if they know how to do it, then...
Treating gum disease is education.
Totally.
And for those patients, just knowledge of is power. And I believe it's not them. Sometimes they know, I need to brush the teeth, but making them understand why they're doing it and why the technique is this way. If they know why that is, then they're much more able to put those things into practice at home.
Right. So my idea is we need to write a book called Start with Dental Care. Start with oral health. Sophie's going to be like, no more projects. So, okay, let's give take-home messages now. What do people do? Do they need to brush twice a day?
Yep.
They do.
Twice a day, morning and night. Last thing before bed.
Before or after breakfast?
Before.
Oh, I love this.
However, or at least half an hour afterwards.
Yeah. I'm a big believer. Before breakfast.
Yeah, first thing, get up, routine, wake up in the morning, brush those teeth, 2 whole minutes. Yeah. And then you want to get something between each tooth, so into dental cleaning once a day.
So something in between the teeth. So
if you just brush your teeth, not into dental clean, you miss 40% of the surfaces.
40%.
40%. So it's almost half. Yeah. So a little flossing.
So if you only brush your teeth, you're cleaning 60% of your mouth. Yep. You're missing out 40%.
And that's if you do it perfectly.
That's if you do it perfectly.
That's if you're doing it perfectly. So that little bit of flossing, those TP brushes or other incidental brushes brands are also available. But they make a big difference. So a little goes a long way. Yeah. And building those practices while your gums are still healthy is much easier to then prevent than treat.
So you know what I say to my patients? I say to the ones that don't floss, I do say, I explain to them why they need to. And then I tell them to floss the teeth they want to keep. And then I say to them, once you've done your first flossing, smell that piece of floss. Yeah. And it stinks.
This is why I love like the intraoral scanners that we've got. Because people, they only, when they look at them out, they just see these front parts.
You're right. They don't see the back or behind.
They don't see what we see when we've got the patient back and we're looking in their mouth. So being able to take a 3D picture scan of the mouth and then showing it to them, being, look, this is what I'm saying. This is why I'm saying floss here. You didn't know this plaque was sitting here and this tartar build up. That's full of bacteria. You need to floss that away every day. And then they go, oh gosh, I didn't even know that was there.
I know.
So yeah, technology and the digital scanners makes huge difference for patient education as well.
You're right, because now they can see what we can see. It's like the intraoral cameras.
Yeah.
They are so powerful because, I mean, even when when you get out an intraoral camera and put it down my back teeth, I go, oh my God. Yeah. And you don't realize what's lurking over there, and over time that causes problems and bad breath and so on. So the reason why I say to them smell it is because I feel like if you smell it and you know what that smells like, you will then always floss because you don't want that lurking in there. So a little bit of trauma to create positive change. But it works. Honestly, it makes a difference. And sometimes my husband gets into bed at night and I'm like, did you floss? And he goes, oh, get out.
Yeah.
Off you go. You need to go and floss. So the before and after breakfast thing, this is such a huge topic, such a big debate. And I am with you 100%. And I want to explain why. Because the educated consumer, I think it's important. Education is power. So do you want to say why?
It's all about like tooth surface loss, right? So the structures of your teeth, the outer surface, your enamel, we want to look after. When you eat your breakfast, you have loads of acids in your mouth. They're being broken down. That saliva in your mouth is acid right now. If you go right in and start brushing, you're just going to be brushing in
an
acids.
acidic environment.
If you do that every day for many years, you're going to be wearing down that enamel surface. Once you've lost enamel, you can't gain it back. Yes, we can treat it. We can cover it up with composite, make it look nice. However, you don't have your own enamel again. And so that's why you want to brush before. So you brush before with a fluoride toothpaste. Then you can go and enjoy your breakfast, or eat your breakfast. Wait at least half an hour. In that half an hour, your saliva will have buffered your that acid back to neutral, and it's safe to brush again. But daily, you do not want to be brushing straight after eating.
You know what? I'm going to agree and disagree with you there, because I think half an hour is not enough. I think Stefan Kerr, 45 minutes. And who's going to sit there? I agree.
Time it.
So what actually happens scientifically is as soon as you put anything in your mouth, breakfast, sugar, anything that is, and everything is sugar. Like, like I said, your milk is got lactose, your fruit has got fructose, your bread has got sucrose, everything is a sugar molecule. Soon as it hits your mouth, within seconds, the bacteria break it down and produce this acid environment. And what you're saying is if you then take this brush, you're brushing in these acids, you're wearing away your teeth. What we know is that when the pH in the mouth drops, it drops to below 5.5. That stays low for 30 to 45 minutes. And yes, it starts to creep back up after 30 minutes, which is why you say, wait 30 minutes. But I'm super strict. I'm like, you even brush your teeth in any kind of acidic environment, you're going to be causing problems long term. So get into a habit of getting up, also getting that gunk off your mouth, so that when you are putting that sugar in your mouth, it's not all this thriving bacteria that is doing that. So for those that say that they eat breakfast first and then go and brush your teeth, you are really doing yourselves a disfavor. And also, once you've worn away the enamel, what you have is dentine, and dentine is sensitive, so your teeth hurt, and dentine is yellow. And
it also then decays more quickly as well than the enamel. So the enamel protects those teeth.
Yeah, it's important. So what about toothpaste? Is that important?
Toothpaste, all I really care about is that it has fluoride in it. I just want it to be fluoride, around 1,450 parts per million fluoride. So have a little look on the back on the label, ingredients of your toothpaste. If you're sat at home, check that it has the right amount of fluoride in it. Once it's got that in it, whatever you like the taste of. I also steer clear of whitening toothpaste, steer clear of charcoal toothpaste. They're all abrasive, and they're going to be wearing down that enamel as well.
You're not going to be getting any long-term benefit from whitening toothpaste.
No, other than long-term sensitivity. And so as long as it's a non-abrasive toothpaste, as long as it's got fluoride in it, whatever you like the taste of.
Is technique important in terms of brushing your teeth?
Yes.
Okay. Tell me what you mean by that.
So the mistake lots of people make is that they brush flat on the tooth. It's all about the angles. If flat on the tooth is 90 degrees, you want to be pointing 45 degrees towards the gum and brushing along the gum line. This is why I want you to use an electric toothbrush, preferably an Oral-B toothbrush with a round head and a pressure sensor, so that you don't want to scrub your gums, you want to gently brush them. So you brush along the gum line, contouring around the tooth, letting the brush do all the work, not too much pressure, but then moving around the mouth. And that's where you want to be brushing. And that will then be brushing away all of that bacteria, all that biofilm, all that plaque, and be preventing things like gingivitis.
Plaque left on the tooth turns into calculus, which is calcified plaque. And that happens within 2 weeks. Well, days actually.
I think it's different between person to person. So I think
depends on how much
some people will say, I'll get it in 2 days. And then some people, it might take a few weeks. But so it depends on that person, but it can form really quickly.
And calculus is rough and attracts more plaque.
Yep.
And the problem with calculus is it's full of anaerobic bacteria.
Yep.
And also, you can't remove it anymore.
No, you have to come see me.
Yeah, you can't remove it at home. It is calcified, stuck to the tooth like super glue. So you cannot remove it with a toothbrush. So what I do after my children brush their teeth, I go, smile. And if I see any, I do this to my husband as well. He's going to hate this podcast. I hope he doesn't listen to this one. Is I check their gums, and if they still got gum, any kind of
get the plaque
disclosing tablets.
Disclosing tablets.
That's what I'm going to get.
Yeah,
and then I go to my son.
We have some in the clinic.
Right, we're stealing that. We're taking that home. And I look at the gums and I'm like, nope, go and brush your gums again. He goes, oh. But I send him back to brush his gums because if not, then he's going to get inflammation. So the last question I want to ask you is toothwash, mouthwash, yes or no?
Mouthwash, yes or no?
Depends.
Main answer, no. No. All your good stuff's in the toothpaste.
Yeah.
It's all that fluoride.
So then I have another question now. Well, I know the answer, but if we're not, the reason why you're saying no is because you're just washing all this fluoride, expensive mouthwash down the drain. And Colgate, we love you, but it's just lining their pockets and not doing you any good. So you don't need to do that. That is just an unnecessary add-on unless you're doing a mouthwash at a different time in the day.
Exactly. Yeah.
So say after lunch at work.
And I say people do love mouthwash and it makes them feel fresher. They want to use it after eating. Yes, that is the one bit of oral hygiene you can do after eating is mouthwash.
Correct.
Because you're not rushing it in, you're swishing it around. It's hard to see all the evidence, but if anything you're gaining is you're making yourself feel a bit fresher, but it's never a replacement to your brushing or your flossing.
Agreed.
It's only ever an addition and at a different time of day.
That's right. I agree with that. We're not going to fight on that one. The thing with the mouthwash that I want to add on is a lot of people rely on mouthwash for good breath, but if you've got bad breath after you're brushing your teeth, you're still unhappy, you probably have gum disease. So get that checked. And also the type of mouthwash matters. So when you go to hotels and they leave this little mouthwash next to you, which tastes good, has jackal in it that is of benefit to your health. Yep. And it's full of alcohol. Actually, research has clinically proven that swishing alcohol around your mouth increases the risk of developing
oral cancer.
Absolutely.
You always have to make sure. Most of the main brands that you'll buy now here in the UK
I say AF on it,
will be alcohol free.
Yeah.
But it's a huge, huge risk factor for oral cancer. Yeah. If you're rinsing with that every day, it's really bad.
Yeah.
So if you've got that at home, throw it away now.
Chuck it away.
If you still want to use a mouthwash, get an alcohol free one.
Definitely. Okay. Love that. I don't think I have anything else. I think we've educated the consumers.
I feel like we could talk forever. But
I know. We'll be a part 2. Thank you so much for joining me.
Thank you for having me.
I hope you guys have enjoyed this episode. And if you want to book in with Jen, you can find her at the clinic. So give us a call.